What's the difference between transgender and cisgender athletes in the Olympics? Have you ever wondered how gender identity plays a role in the Olympics? The distinction between transgender and cisgender athletes is quite significant. Cisgender athletes identify with the sex they were assigned at birth. For instance, a cisgender woman was assigned female at birth and identifies as a woman, while a cisgender man was assigned male at birth and identifies as a man. Transgender athletes, on the other hand, have a gender identity that differs from their assigned sex at birth. A transgender woman, for example, was assigned male at birth but identifies and lives as a woman. This difference is crucial in the context of Olympic competition, which is typically divided into male and female categories. The International Olympic Committee has put forth policies to include transgender athletes while aiming for fairness in competition. Historically, transgender athletes had to undergo gender-affirming surgery and hormone therapy before competing in their identified gender category. However, since 2015, the committee has shifted its focus. They now prioritize hormone levels, particularly testosterone, as a key eligibility criterion for transgender women competing in women's events. Research indicates that transgender female athletes who have undergone at least 1 year of testosterone suppression and estrogen supplementation show a mixed profile of athletic performance when compared to cisgender women. For example, while transgender women may have greater hand grip strength, which indicates muscle strength, they often have lower lung function and cardiovascular fitness. These findings challenge the idea that transgender women have an absolute advantage over cisgender women in every aspect of athletic performance. The International Olympic Committee acknowledges that many factors influence athletic performance, and these factors can vary by sport and individual. Their current framework promotes a sport-specific approach to eligibility criteria, balancing inclusion and fairness. This framework was developed after extensive discussions with athletes and stakeholders, aligning with the Olympic commitment to human rights and non-discrimination. In practical terms, transgender athletes who meet the International Olympic Committee's hormone level requirements and other sport-specific criteria can compete in their identified gender category at the Olympics. This approach aims to respect the identity and well-being of transgender athletes while addressing concerns about competitive equity. So, the main difference between transgender and cisgender athletes in the Olympics is their gender identity in relation to their birth-assigned sex. The International Olympic Committee is continually evolving its policies to ensure both inclusion and fairness in competition.